Hi friend, this is Tender and Wild, a special season exploring what it means to heal from pain, reclaim your voice, and find God in the places you least expect. Because we need both, the tenderness to sit with our wounds and the wildness to reclaim our lives. Hi friend, I'm Wai-Jia, a doctor, humanitarian worker, accidental comedian, and fellow traveler in healing. I'm a complex trauma survivor, which is what inspired me to learn more about trauma and share what I've learned with you. This season, I've invited some of the world's leading voices in trauma recovery to share. Some are Christians, some aren't, and that's intentional. Because truth and wisdom can show up in places we least expect. And I invite you to listen with both openness and discernment. My hope is to create a space where science meets soul and psychology can walk hand in hand with faith. Some of these conversations might stir up difficult emotions or memories. And if that happens, feel free to pause, breathe, step away, or just have a good cry. Come back when you're ready, or recognize that this may not be the season for this content, and that's okay. This space is not about pushing through, but about healing gently, with honesty, courage, and compassion for yourself. Because healing isn't linear. You're allowed to have hard days, to stumble, and still grow. To anyone hurt by the church, scarred by family, or disillusioned by those you trusted most, this is for you. Because maybe healing isn't becoming who you were before, but the audacious becoming of who you were always meant to be. You can heal. You can reclaim your life. Let's dream bravely again. Hi friends, today I have with me a very special friend, Anya, a psychotherapist with over 2 decades of experience in trauma and addictions. Anya, welcome.
Hi, nice to be here. Thank you so much, Wai-Jia.
I am so privileged to have Anya today because she was a friend of a very close friend I have, and she is absolutely my go-to person whenever I need a solid book recommendation on trauma and healing. With over 20 years of experience as a psychotherapist, working across the NHS, private practice, and community services, Anya is highly accomplished as an accredited member of the British Association of Counselling and Psychotherapy. With a master's in Existential Psychotherapy, and we'll ask her more about that in a minute, Anya brings exceptional depth and humanity to her work. Beyond her clinical practice, she trains frontline services, NHS teams, and charities on complex trauma. I honestly can't think of anyone better than her to help us break down some of the most challenging concepts and misconceptions around trauma into digestible, bite-sized pieces. Anya, a big welcome to you.
Oh, thank you so much, Wai-Jia. Gosh, that feels very big to hear yourself reflected back in that way. But thank you so much.
But that's why I feel it's such a privilege to have you with us. Now, for those of us who are new to you, Anya, could you share who you are and what an existential psychotherapist is?
Yeah. So, as you said, I'm Anya. So I've been a psychotherapist for over 20 years, and on my psychotherapy journey, there's lots of different models that we can all train in as therapists. Many of you will have heard CBT or psychodynamic psychotherapy. And for me, it was, whilst I worked for the sexual violence service in London at King's College Hospital, I had this sort of awakening to how I wanted to be with my clients, with the relationships that I was privileged to be working with when working with survivors of sexual violence. And a colleague of mine who had done her counselling psychology doctorate at the same place I did my master's introduced me to existential psychotherapy. And fundamentally, existential psychotherapy is about looking at the philosophy of the individual. It's not looking at you meet this collective set of symptoms to reach a diagnosis and we'll treat the diagnosis or treat the symptoms. It's far more about understanding what it's like to be you and the philosophy of being you. And thinking about it from that, the word they use is the phenomenology. So the relationship then between me and my clients and the importance that each relationship is completely different. It is unique because it is our relationship. And although I wouldn't bring my own personal stories necessarily into the therapy, who I am as a person will influence how I am as a therapist. And for me, holding that in my mind is really, really important whilst I'm working with people. So, sort of in a nutshell, it's looking at that sort of existential thought process and thinking about people from their sort of their own lived experience and spirituality, psychology, biology, all of that in encompassing, and not for me to judge. Not for me to judge what somebody rates or somebody brings as more important than another. I remember one of my lovely tutors, he was a wonderful man, and he said, you may have a client and they may have 3 presenting issues. They may have lost their job, their mother may have been diagnosed terminally ill, and they may have run out of milk.
Right.
Running out of milk may be the thing that they're most distressed about that day. And actually, that's about your job to not assume that the other things are the things that are more important for that person to explore.
I hear you. And I think that is so refreshing to hear, Anya, because, I've gone through my own journey and, trying different kinds of healing, whether it's, therapy work, counseling, church work. And something that's quite common, I'm sure in Western circles as well, but particularly in Asian circles, is I think this self-imposed or an imposition of kind of advice. And I think what you're sharing is exactly the opposite of that. You're actually using your personality or your kind of interaction with the client that you see and inviting them into a space where your interaction helps them understand who they are in the world. Isn't that true?
Yeah, it is absolutely. It's about that shared experience. It's a relationship. And as I said, although my story doesn't necessarily get presented in that relationship because the client, it's very much about them. I'm influenced by my own story. And so there is that level of presence in the phenomenology in the relationship. Does that make sense?
I love that. I love that. And I think today, that's why I feel really privileged to have you share with us some of the basic foundations of, the kind of language that we use around trauma. But before that, could you share with us what first drew you to this work of trauma, suffering, and healing? Because these are really not easy topics or pleasant topics to face every single day.
So I think it's really important. I grew up in a home where sort of both my parents worked in the mental health field, and I grew up seeing them helping people and human beings mattering, and it didn't matter where people came from. As a child, my dad ran the community drug and alcohol team, and I remember learning it was really important not to judge people and to understand that people who have complex lives also have complex stories. And I feel very privileged to have grown up in a household where storytelling was actually one of the foundations of my childhood, was hearing stories and telling stories and understanding the journey of a story. And so that had an influence. I had a brief career in the music industry that didn't last very long, and then I ended up. I realised that my calling was, to work with people, to see the humanity in everybody, and so I ended up working in addiction services and found it very rewarding. I then took some time out to go travelling, and as you know, I ended up working in Tanzania in
Yes.
Moshi for a short period, doing some volunteer work, and again felt really drawn to working with people. And so when I returned from my traveling, I saw the job in the Havens, and I felt like this was really important. So my work in addictions was always the fundament always was trauma. That what has happened to
Wow.
these people, not what is wrong with them, but what has happened to them, what has happened to their nervous systems, their bodies, their experiences to make them struggle so much, to make them have to use drugs or alcohol or other high risk behaviors to cope. And it was never about, let's get you to stop taking the substance. It was much more about what happened to you and how can we find other ways for you to take care of yourself and feel safe again. And I think that's a really,
Wow.
really important aspect. And then the opportunity to work in the sexual violence service then further honed, again, victims of any form of interpersonal violence, this is something that has happened to them. They haven't asked for this. This isn't something that, is led to because of how they live their lives or behave. This is always something that has happened to them. And how do we help make sense of this? How do we make sense of something so abhorrent and so awful? And that's what really, and it was my colleague saying to me to read Man's Search for Meaning, which is by Viktor Frankl, which is a
Yes.
life-changing book for me. And he developed logotherapy, which was one of the first forms of existential therapy, meaning making. Existential therapy is finding
Yeah,
meaning in your journey, your purpose, your meaning. So yeah.
absolutely. Anya, many people often feel that their trauma is not big enough, their trauma is too small, or because their trauma is small, then therefore they must be weak for feeling traumatized or feeling so much pain from it. The book that you had shared with me before, Men's Search for Meaning, and there was something called the bell jar analogy inside. Could you share with me and our listeners a little bit more
Yeah.
about the bell jar analogy?
And I think this is such a useful way, when we're thinking about trauma and we're thinking about comparison, this is what people do, or benchmarking.
Mm.
And in Man's Search for Meaning, Viktor Frankl says if you have two bell jars of different sizes, so one really big and one small, and you fill them both with gas, the gas will distribute itself evenly across each jar. So it's not relevant what the trauma is. If surviving the Holocaust was your trauma, that's your trauma. If losing a pregnancy is your trauma, that's your trauma. And you can't compare to the two. You can't say, but it's it's not too bad because I didn't survive the Holocaust and that's much worse, because that isn't your reference point, that isn't your benchmark. And so I think this is really important. When I worked at the Havens, we ran an interpersonal group therapy service, and what we decided to do was not have people share this story of what happened to them, but share how they were feeling around what happened to them, to reduce this
Wow.
chance that somebody might say, oh, well, what happened to her was worse than what happened to me, so what happened to me doesn't matter. We didn't want that to be part of the context around how we value trauma. So what we did is we said, right, we're gonna trust that we've assessed everybody and we know what that benchmark is in terms that they've all qualified to be in this group. But actually, we don't want the individuals to be comparing their trauma and then evaluating whether they get to feel as bad as they do. So we said we
Wow.
don't share the inter parts of the story. And actually, what we noticed was everybody felt the same. Everybody had similar responses, similar feelings. So that's a really good example of the bell jar live in action, is that if they'd all known their stories, somebody might have gone, oh, well, mine doesn't count because it was nowhere near as bad as that person because that person's was much, much worse than mine. Actually, we took that away and what we distilled down was the impact of trauma. And that was pretty universal.
Wow. I hope this, reminds all of us to have self-compassion on ourselves, because we always use the event to compare. But what you're saying is that if it's like gas in two different bell jars, the gas just fills the entire bell jar. There's no sense of, is there more gas or less gas in a jar? Is this
Yeah,
gas more toxic or is it less toxic? It just fills the jar. And I think that helps to
absolutely.
give each of us more self-compassion instead of shaming ourselves, which is probably the biggest hindrance to finding healing, is to shame ourselves to say, you are so bad, you are so useless that you
Yeah.
can't, that you're held back by even such a tiny incident.
Hmm. Absolutely, Wai-Jia.
That's incredible. So, Anya, many people hear the word trauma and they just think of extreme events like a war or, like you said, sexual violence. But in your experience, what is trauma really? Because it's used as such a buzzword these days. Like some people even just casually say, oh, I was so traumatized this morning at the supermarket. And it could be true, but it could be false as well. So, could you
Sure.
help us understand what trauma is?
Absolutely. I'm going to steal a Gabor Mate kind of comment because he's somebody who I found very inspiring in my work. And he talks about trauma is not he talks about trauma is not the event itself, but trauma is what happens inside us when we experience the event. And I think that's
Wow.
really important. And that's why it's important not to differentiate or lay a universal benchmark for what quantifies as trauma. Does that make sense?
help us understand that difference between, big T trauma and small T trauma? Because that's what people like to differentiate, right? They're like, oh,
Yeah.
this is not big enough. This is like a small T trauma.
Yeah.
But you're saying we shouldn't differentiate? Is that right?
Well, I'm saying we shouldn't judge. I think there's a slight there's a difference between differentiate. Of course, if I was in a tsunami, that's a very big T trauma. That's a very quantifiable trauma that everybody would go, oh goodness, that's massive. And like you're saying, the supermarket, somebody else might be like, what? The supermarket? But I actually had a client fairly recently, and we talked about how traumatic it was for them when they went to a new supermarket, when they were really dysregulated, and going around the supermarket felt really overwhelming and really, really difficult, and really sort of left them feeling quite traumatized, because it was unfamiliar, it was new, it was distressing. Now,
Right.
universally, that wouldn't be identified as a trauma, but in the work that I was doing with this client, it was seen as that. And I remember saying to them, gosh, that sounds really traumatic. And they were like, it was. I just came out and I had to sit in the car and I felt my heart was racing and it was really difficult. Whereas if somebody said, oh, they were in a tsunami, we would all universally go, I get that. And so it's about not judging what somebody experiences trauma, and understanding, yes, there are differences, but also those differences are still individual, because there will also be people who have survived a tsunami who don't feel traumatized by it. It doesn't mean that they're dissociating. It doesn't mean that they're in denial. It means that they don't feel traumatized by it. And there are other people who will feel very traumatized by it. And it isn't us to suggest that the person who didn't feel traumatized is strong, and the person who does feel traumatized is weak and incapable. I think it's really important that we just look at different people will have different responses. And we have the same in the army. If you thought in the military, you will have people will go to war. Some people will come back and they won't be affected by it. They can do whatever their brain needs to do to manage that. And some people will come back and be changed irrevocably. And I think it's about understanding it doesn't make somebody weaker or stronger. It's just that we are different.
Wow. Oh my goodness. Anya, I think you just uncovered something that's really central in the idea of trauma that I think many of us have not realized. So what you are saying is that trauma is not the extent of the event that has happened to us, but actually what happens inside us. And the key concept that I feel you have brought out, which I think so many of us overlook or downplay, is this idea of self-compassion and non-judgment.
Yeah.
Right? Because I think so many of us, we tell ourselves, oh, whatever I went through is not considered trauma because it's not a big deal. And I think many of us kind of minimize what has happened to us because we think it's not a tsunami, it's not war, I wasn't raped, it's not too big of a deal. But what you're saying is that it's about what happened inside of you.
Absolutely.
Right?
Absolutely, Wai-Jia. And what you'll have is if inside you have a reaction or a response, but the outside world has a different response, it creates dissonance. So we go into, again, if I said I was in a tsunami, everybody around me would go, gosh, Anya, that must have been awful. Okay.
Yeah.
And I would go, yeah, it was awful. My inside world would go, yes, absolutely, that was terrifying. And the outside world would go, gosh, yes, absolutely, that was terrifying. So then you have congruence. Does that make sense? You have that
Yes.
connection, which makes me feel safer in my lived experience.
Right.
Whereas if I experience something traumatic and I say to somebody, oh, this is what's happened, and they're like, what? That doesn't sound very bad. I suddenly get dissonance. I don't feel safe because my experience is not being seen or validated. I feel inside, oh gosh, I've got it wrong. So my natural response, my authentic response is incorrect because the outside world is telling me it's wrong. And this is often what happens to children, is a child will have a response and a parent or a caregiver or an adult around them will say, yeah, you're all right. And the kid's like, well, I don't feel all right. So you're telling me I'm all right, but inside I don't feel all right. So I must be wrong because you're a grown up and you're the person who is supposed to know better. Does that make
Oh,
sense?
wow. I love this, Anya. This concept of congruence is so important, like of
Mm,
being seen. And I think
mm,
this is a theme where it keeps coming up when people talk about intergenerational trauma. Because I think it's
mm.
exactly what you said. When children go through difficult childhoods, such as, neglect or being emotionally abandoned, these are not seen to be big things. And sometimes parents can downplay it by saying, but I gave you a great education. I gave you food on the table. Like, what more do you want? And this
Mhm.
dissonance can, in fact, as you're saying, cause a sense of trauma inside a child as they grow up. Is that right?
Yes, and I think, and remember, Wai-Jia, I think this is really important to caveat as well.
Yeah.
Bringing my existential lens and model. This isn't a
Right.
hard and fast science. This
Mm,
is scientific. We are looking at research. I did my master's, research on sort of looking at existential therapy in trauma. And so I think it's important to acknowledge that other people may have a different lens, and that's also
right.
okay. When people listening to this are thinking about what sort of therapy they might want, or this is a lens, this is a model, this is a way of working.
Sure.
And the neurobiology that we'll talk a little bit more about, I'm sure, that's pretty well founded and documented and researched. But I think
Yeah.
it's important for people to be allowed to think differently and think, I don't agree. That's really important. Um,
Sure.
but for me, yes, this very much is about if you experience this internal incongruence or internal dissonance, then that can have a long term effect on your belief about your value in the world. If a child's needs aren't being met, and if those emotional needs are important, this is why I'm very much I follow sort of more of an attachment theory when
Yeah.
thinking about early childhood experiences. And when thinking about, I come from the UK, and boarding school is quite a prominent thing. And often children were told, it's less prominent now, but children were told, you should be grateful because I'm giving you this great education. Whereas the child feels inside, but I'm being sent away and I don't like being unsafe. But I'm told that that feeling isn't okay because this big sacrifice has been made to give me this brilliant opportunity. So you create that
Right.
distance. Does that make sense?
I really like what you're saying. And I think that's such an important thing for parents who are listening in to kind of understand and to let sink in. Because both things can be true, can't they? Parent can make great sacrifices, and at the same time, a child should be allowed to feel that sense of abandonment and rejection. So I think
Yeah.
one of the biggest things I've learned in my parenting journey is actually just to reflect what my child is feeling. Like my second child has a bit of a melodramatic flair, reminds me a little bit of me when I was a child. And sometimes the best thing that I could do for her, I think, is just go to her and say, "Oh wow, that looks so painful from the sound of your voice. That sounds really, really painful." And the funny thing is, the moment I acknowledge it, it feels like the pain diminishes by like 90%. And
Yeah.
that's the
So
idea of feeling seen, right?
absolutely. And that down regulation and that co regulation. So, again, Dan Siegel, who is an American psychiatrist that I really admire his work. And he talks a lot about how unless we can experience human connection, even if a threat has passed, it's really hard to come back down that sort of threat response. So, in a
Wow.
child's world, if they feel distressed or threatened or unhappy about a situation, often
Mhm.
it is just the acknowledgement that what you're feeling is seen and it matters. And that just brings them back down into that sort of window of tolerance where their nervous system can feel, I'm safe, I'm seen, and my authenticity is allowed. I don't have to configure myself to be able to find a sense of safety, that safety is provided unconditionally.
Oh, I just love that, Anya. I feel like you've given so many parents like an aha moment right now. Now, when we talk about suffering, I think it's also very easy for us not just to dismiss our child's suffering, but,
Mm.
we've talked about, so many of us these days talk about the inner child inside of us. And I think many of us are perfectly capable in today's busy world to actually forget to tend to the needs of this inner child. And there was a conversation I had before about, this Russian doll analogy. And I would love for you to expound on that a little more, if that's okay.
Yeah, absolutely. I think it's really important that we think about, so the way I think about it, and it's, Richard Schwartz, who sort of developed internal family systems work, and there are other people. There's lots of different ways of presenting this, and this is just how I've interpreted some of this wonderful, rich kind of knowledge and conversation that's out there in the psychology world. But I kind of think about, inside us, we have a set of these little nesting dolls. I think you can probably see mine just in the corner next to my ode to Deb Dana and her brilliant polyvagal chart. Um, but yeah, so I've got my little nesting dollies in the corner. And what I think about with this analogy is that when we're safe and we're securely attached, each dolly will jump into the next dolly. And then when you kind of reach adulthood, you've got one solid dolly. You give it a shake, you can hear all the other little ones in there, but they're really solid and taken care of. When we have complex PTSD, or we have lots of little T's, and I will talk a little bit more about the theory around those two statements sort of shortly, what happens is those dollies kind of get stuck and they're not
Mm-hmm.
quite able to jump into the next one. So they kind of stay lined up. Okay. And then how I think about it in adulthood is, if we experience something that re traumatizes us or disturbs our nervous system, one of those little dollies will come out and drive the bus. Does that make sense? And I think it's
Mm.
important to think about in psychotherapy, if it's okay, if it doesn't disrupt anything, I'm going to just move my camera so you can see my dollies. So what I do in my work is move from having everybody sort of, you know, lined up and not working together. I really work hard to get us to understand all the different parts of us as a person, understand the most vulnerable part, and get them to work together as a team and think, okay, what part of me, if I feel distressed, what part of me, and one of the best ways that you can identify it is, I will say to my clients, does your response feel proportionate to the situation?
Ooh, okay, I love this. Hold on for a moment, Anya. So for those of you who are not actually watching the YouTube and just listening online, what Anya is showing is actually these nesting dolls, or what some of you might know as Russian dolls. It's like a mini girl inside another medium-sized one, and the medium-sized doll is inside the larger doll. And what Anya, what you're saying, I think, is this, the word that keeps coming to mind is integration. You're
Yeah.
helping people integrate the different parts of themselves
Yeah.
so that they can be their most authentic and also most adult self, or most appropriate
Yeah.
self at all times, so that the little one, who is what I think, correct me if I'm wrong, the hurt inner child, doesn't come out and drive the bus, which is what triggers a lot of our so-called
Mhm.
triggers or
Yeah.
reactions. Am I right?
Yeah. Absolutely, Wai-Jia. And I'm thinking
Mm,
about, how do we, and that's why I use the word proportionate. So I'll say to somebody, um,
right.
going into the supermarket, for example, and finding that really traumatic, I will say, did that feel
Mm,
proportionate? So not dismissing, this isn't trauma, this is just shopping. I'll say, did it feel
right.
proportionate to the event? And they'll be like, well, no, not really. Okay, so maybe this is something that has caused one of these little dollies to come out and drive the bus. Does
Right.
that, I make that sort of work? I'm conscious about not saying, does that make sense? Because I know that I say that a lot.
No,
But
no, that makes a lot of sense, Anya. And I think you also answer my next question, which is actually, a lot of us actually feel triggered from in our day-to-day lives. Like, somebody said this to me, I met this
yeah,
person, and I don't know why, I just feel so out of control. Like, it feels like
yeah,
somebody inside screaming. And now when I
yeah,
use the paradigm that you've shared, it feels like the inner child inside of us with unmet needs is the one that is screaming.
yeah.
And so when we say that we experience a trigger, are you saying that that is actually our inner child blowing things out of proportion for ourselves because that inner child was never met and seen and validated?
And I'll go back to, I'm not sure whether it's blowing it out of proportion, but it may be disproportionate to this event. So again, another,
Right.
I'm the woman of analogies. So the other way I look at it is that little vulnerable part comes out, and
Right.
here's a bit of
Hmm.
science in this. Our amygdala, which is our scanning part of our brain, will scan to see if this threat is familiar. Okay.
Okay.
and then it will kind of pull up the fishing net, and it might look in that net. And if there's like one tiddler little fish in there, it'll go, no, okay, this is proportionate to this situation. This matches up. This feels congruent to this situation. If you look in this net and it is bursting full of historical trauma fish, then you can be like, this is not proportionate to now, because this is all of these fish have woken up in the net and they're all wiggling and jiggling and telling me that it's not safe, because that's their
Right.
memories and their experience. So more than it being the inner child unmet need, it's the inner child's emotional response to that traumatic event waking up and being felt in the body.
Wow. 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 Thank you, Anya, for putting it that way. And so in today's world, how can we meet those needs? How can we help to unpack that emotional response and move past some of our disproportionate emotional responses? How can we do that?
Um, So there's lots of different ways. And again, I really want to be clear to people. I'm not a therapist who says therapy is the only way, because
Sure.
that's dismissing a lot of people's experiences and a lot of what people are wanting in the world. I think there's multiple different ways we can do it. I come from a sort of psychology perspective, but
Mm-hmm.
I think it's about understanding. I'm very keen, and I know that this sort of set of interviews that you're doing at the moment is about integrating the science with the sort of spiritual. And so for me, there was
Yeah.
something really important about understanding the science, the neurobiology of what's happening to me when these
Right.
things have occurred. So when I experience trauma, or when I experience re-traumatization from childhood, because often in childhood you do not identify what you've gone through as trauma. It is the adult lens that
Mm.
reflects back that goes, oh, actually, that wasn't okay. Or I have people, they have their
Wow.
own children. Yeah. And they'll say, that wasn't okay. What happened to me as a child? I would never do that to my child. And so
Wow.
now I'm identifying. Does that make sense?
Yes, and I just want to say a word of validation to parents who are listening. I feel like so many of my friends and myself, they have this aha moment when you become a parent yourself, or when you become an aunt or an uncle. And then
Mm,
you see how your own parents treat your children, or you see how other
yes.
parents treat, your offspring, and you suddenly have this reaction inside of you. And I think that's exactly what you're saying. It's a reflection back on your own childhood and realizing that,
Mhm.
oh my goodness, this is actually normal, and what happened to me was not normal. And I think
Yeah,
people sometimes don't know what to do with that. And I just want to assure
absolutely.
everyone who's listening that this is very normal and it's okay to kind of work through those feelings,
Absolutely.
emotions, reflections, right?
Absolutely. What is wonderful is, Wai-Jia, you as a doctor will know this, is the incredible um, human body and mind and how we can work through things. Um, and I really like, again, I'm going to go back to some of Dan Siegel's work. He talks about that we all have this organ called the brain. So you and I have a brain. Everybody listening to this podcast has a brain, but each and every
Yeah,
one of us has a separate individual mind. And that
right.
mind can help update and
Mm.
influence our brains. And I think that's what's really amazing about human beings. And our brains can work around with our nervous systems. So if our minds can help our brains, that can help our nervous systems, then we can look at processing what we've experienced in trauma.
Wow. So having spoken about, some of our childhood triggers and having spoken about, what trauma is like, could you help us understand, Anya, what people mean when they say simple trauma versus complex trauma? Because I think these are words that, are just thrown around and most of us don't fully understand what they actually mean.
Yeah. So when I'm thinking about things like the DSM criteria, so that's the diagnostic manual that's used in mental health and psychiatric services, mainly in the USA and in the UK, and we also have the ICD 10 or 11, I think we're on now. So we have diagnostic manuals, and so what they want to do is differentiate between the two different types. So we have PTSD. So that's what people will have heard, which is post traumatic stress disorder. And it's really important that I just kind of stress that PTSD is a very specific set of symptoms that meet a threshold for a diagnosis. Okay, so that's
Mm-hmm.
PTSD. And
Right.
PTSD tends to be a single episode trauma. So an event. So that might be a burglary, a car accident,
Right.
um, witnessing a fight or something like that. Okay, so it's a
Right.
single episode event that then causes the nervous system to have a reaction. Okay, so we're going back to Gabor Mate. It's not the event that is trauma; it's what happens inside us. And some people will have the same event, and some people will have met the threshold for PTSD. Some will not have met the threshold for PTSD at all, and some may have what I call PTSS, post-traumatic stress symptoms, but they don't meet the diagnostic threshold. Does that
I
make
hear
sense? But
you.
again, I'm not
Absolutely.
I'm not so driven by sort of, the threshold level. I'm more around the individual story. So you've got the
Right.
single episode trauma, which is that single episode, it's a traumatic event.
Mm-hmm.
Complex trauma tends to be more um, endured trauma. So early childhood trauma, like you've already named, things like neglect or childhood abuse, sexual abuse, physical abuse, not being safe, being in war, sexual violence, and all of these more prolonged traumatic events or traumatic periods can then lead to somebody having more complex trauma. And that's when somebody's, I guess in my mind, my interpretation is when somebody's nervous system remains in this kind of constant state of threat, and that they have to navigate their whole lives from this very distressed, hyper aroused state. Does that make sense?
Wow. Anya, thank you for sharing that. Yeah, I'm feeling a little bit emotional, to be honest, because I remember my therapist telling me that when she first saw me, that she suspected I have complex trauma because it's like a car alarm system being constantly on hypervigilance. So she described it as me being a car that was underneath a tree, and ordinarily a leaf that falls on it should not have a reaction, but my car alarm is blaring off at every leaf that's falling on me. And I think what you've just shared with us really explains
Yeah.
why that's happening.
Yeah. And
Yeah.
and
Mm.
and that's a really lovely example for you to share, Wai-Jia, and I think that's really important for us to think about. And what happens is that car alarm is going off all the time. That person feels really threatened, really stressed, really, overwhelmed. But then also people around that person might be like, why is that car alarm going off all the time? That's really disruptive for me. Or I don't
Right.
understand what's wrong. So it can have an impact on people's relationships with people around
Right.
them, with their family, their loved ones. So it makes it even more complex how to cope and live with somebody who's got complex trauma. And it's really important to understand that this is where compassion is such an important and key ingredient to working with people who've experienced trauma.
So true. Is it possible, Anya, for somebody to actually have complex trauma but not even realize it? Because obviously I've probably had this, for decades and decades. And it's only since coming to Tanzania when I met with a very unique set of extremely stressful and challenging circumstances that it came out in a certain way. Like for me specifically, it was feeling like a lot of bodily distress, like having diarrhea and just tears whenever I heard a persistent kind of sound or and things like that. Is it possible for someone to just suddenly have it, so to speak?
So I think when we think about complex trauma, the reality is, I imagine what you're talking about is that fishing net. So when that fishing net may not get pulled up very often, so one doesn't necessarily identify their long-term complex trauma. But actually, when they are set up with a set of specific circumstances like you've just described, it pulls that fishing net up. You can see all of that history and you can't move away from it. And we know sort of people with complex trauma may not identify having complex trauma until they're in a therapeutic environment, when you look at things and unpack things and say, gosh, I've said to clients before, gosh, that sounds like that must have been really difficult. And when someone's gone, oh, actually, yeah, that was. And that's probably why, we think about terminology like hyper-independence. It's a very common form of coping with
Yeah.
sort of complex trauma, is somebody who's like, well, I don't trust anybody. I don't need anybody. I do everything on my own. I have no expectation of another human being. I don't want friends. I don't want a partner. I don't, because then I can't be let down. They don't necessarily say, I have complex trauma. But that reaction, again, we go back to our word proportionality, that response is probably disproportionate to live in the world if you hadn't experienced some form of complex trauma. Does that help
Right.
make that make sense?
Yeah. Yeah. Thank you. Thank you, Anya. And I also want to give our listeners some perspective. Like, I don't want you to leave this podcast, friends, thinking or self-diagnosing, like, do I have simple trauma, complex trauma? This is just to
Yeah.
give you kind of a taste or a flavor of the kinds of different kinds of trauma that are out there. And I think, to really like have to really understand whether you have a condition or not, it will take, more reading or even seeing someone who's professional. And yeah, at this point in time, as you've talked about the brain and the mind, you've alluded a little bit about how the brain actually affects our body. Could you tell us a little bit more about somatic work? Because
Yeah.
when I first experienced a lot of bodily symptoms, so it first started when I went for a spine operation and I had chronic pain. So the pain post-operation was actually told to me to be normal. But when it was prolonged and when I noticed that it was very closely tied with some emotional or emotions or thoughts that I had, I began to suspect that, okay, I think that there's a very strong psychological component going on. Because sometimes when Cliff would even mention particular people in my life, I would start to ache so badly down my spine and my arm. And that was when I was first introduced to somatic work. So could you
Mhm.
tell us a little bit about what that is and why
Yeah.
it's such a central part to our healing?
Absolutely. And I mean, I'm not a somatic therapist myself, but I know that there is lots of amazing somatic therapists out there. But what I tend to do is I tend to coordinate with people who work with the body. One of the things that I say to people when I start working with them is often talking isn't enough. I'm not going
Mm.
to take a platform and suggest just talking to me is going to heal all your problems, because that's not how I roll. I'm much more about the relationship that we gain together and what other wonderful techniques can we interweave. If I want a cake, I can't just put sugar in a bowl. I have to put in the eggs, the flour, the butter. I have to mix it all together. I have to be patient. I have to wait for it to
Mm.
cook. Does that make sense? So it's the same sort of thing. It's about
Yeah.
having a collection, and I can't be all things to all people. So I often think it's important to have more people involved in someone's discovery of who they are, rather than thinking I can do it all with you. But I certainly think somatic work, the way I describe it and talk about it is, we've got different types of memories. We've got explicit and implicit. Okay, so explicit is a memory that we can recall here. So if I say, what did you do for your last birthday? And I'm sorry, listeners, you're all now thinking about what you did for your last birthday. You've gone into your explicit memory part and you're all pulling up a little picture
Right.
of your memory minions have gone into the filing cabinet and they've pulled out birthday. And you're now sort of thinking, what did I do? And you're building sort of a picture in your mind ready to be able to describe that back to another person. And that will then help them identify that memory of what you did for your last birthday. So it's an explicit memory. But we also have implicit memory, which is memory that is implicit in our bodies. Driving a car or driving a bike, cycling a bike is a form of implicit memory. You just do it. If someone said to me, how do you cycle? I'd be like, you put your hands on the handlebars and your feet on but my brain is telling my body, I know what I'm doing. Does that make
Yeah.
sense?
It feels very
Now,
natural.
exactly. Now, what we know in trauma memories is very often a lot of the memory is held in the body. So,
Mm.
particularly, I remember when I worked at King's College in London, I'd have clients would say, I got on the tube and I can smell the scent of the person who assaulted me, and my body had this huge reaction. My body
Mm.
felt like what was happening to me was happening to me again.
Right.
So that's a physical memory. So for me to say just talking is enough, I've discarded this bodily memory. So
I
that's
hear
why I
you.
think sometimes it's really important to include somatic work so that the body's responses can be acknowledged and seen. We also know that the nervous system can be really soundly regulated with body work. People like Bessel van der Kolk, who is, world leader. I know Deb Dana. People like that all commend how important it is to include the body breathing. We know the work that Wim Hof has been doing around sort of nervous regulation by cold water dipping and things like that. There's lots of evidence around that actually doing work around your body is super, super important. I love the work of David Bocelli and his trauma release exercises, and I recommend anybody to look into this because it's a phenomenon that mammals engage with anyway.
Right.
But it's a really good way of processing internal trauma or that implicit trauma alongside using appropriate trauma therapies like eye movement desensitization and reprocessing, so EMDR, which is in the UK, that's a nice guideline for treatment, or using things like trauma-focused CBT, but having proper trauma-focused psychological therapy with a trained individual, or and alongside using the trauma-focused physiological or somatic work.
Wow, thank you so much, Anya. Friends, you can see Anya is really a walking encyclopedia. Anya, you have inspired me to actually compile a list of all the authors and the big names that you've shared. I'm going to compile that list, a book list for our listeners today so that they can follow up if they're interested. Yeah. But I really hope that this conversation helps all of us to really reflect on the kind of help that we need. Because I think sometimes when we look for a therapist, we don't even know where to begin. And it took me a good 2 to 3 months actually talking through our mutual friend. I remember for me to realize that, actually what I really need is a somatic practitioner. And I think that was what gave me the breakthrough in helping me heal from chronic pain at one point in my life.
Yeah.
But Anya, it makes me think that, a lot of our listeners here today identify with the Christian faith. And I think unconsciously, maybe in some charismatic circles, maybe I can see that some practices like, going up to the altar, getting prayed for, having, being able to weep into somebody's arms, or, at times there are people who practice getting slain by the spirit, it's where someone prays on you and you fall backwards and then they start to shake on the ground. I wonder if these actually have a neuroscience component behind them. But at the same time, I also want to ask you, because I know you see a significant number of clients who have been abused or hurt in religious spaces. I would love to ask you, Anya, some people in church feel that if you're exploring trauma recovery, it could mean that you're weak in faith and that you didn't have faith strong enough to trust God for your healing. How would you gently respond to that suspicion and skepticism around trauma therapy?
Okay, so one of the things I think is really important is I go back to my existential philosophy. If somebody presents to me and their faith is really important to them, then I weave it into their work because it is really important to see the whole person and not dismiss what they are experiencing. And I can understand there may be anxiety around that word dissonance, or sort of, that disconnect between my faith should bring me through this. But I want us to remember that the body, like I've just said, our mind is separate, but our organ is the brain, which connects to our nervous system, that connects to our whole body. And I think it's really important that our minds are really valuable and powerful, but they're not powerful enough to fundamentally think our way better from certain situations or things. I wouldn't expect anybody else to suggest somebody didn't see a doctor if they had broken their leg and that they could that their faith would heal their leg if it needed, say, pinning or surgery. But what I imagine they'd say is that your faith will help you get through the recovery of that pain, will help support you like crutches to take you through that journey of having to have physio and tolerate the pain and be uncomfortable and have like a scary operation. So that's what I would imagine that one would say to somebody who had that sort of medical condition. And that's what I would say to any of my clients. And whatever faith you have, that faith can be somebody, if it's Christianity, you can think, God is walking by my side and just acknowledging that I am undertaking an enormous journey of change, an enormous journey of discovery, and that God is by my side whilst I undertake that and isn't critical of me doing this, but is actually proud of me for exploring who I am and working through what has happened to me so that I can be the best version of me and have the most authentic version of me.
Wow. As you were sharing, I had goosebumps. And I think some of us maybe need to write this down somewhere. For those of us who are struggling with, wanting to honor our faith and yet afraid that therapy or somatic work might somehow diminish God's role, maybe we should write that down and say that, I want to remember that God is walking by me even as I undertake this tremendously courageous journey of uncovering myself, of discovering who I am in the world, and also of overcoming my pain, however that might look like. Wow. Wow. Thank you so much, Anya. And as we come to a close, I would love to ask you just a couple more questions about integrating spirituality and trauma recovery. Because to someone who's suspicious of actually marrying the two, or to someone who's hesitant to actually get help for themselves, what do you think is one small, compassionate first step they can take today towards healing for themselves?
Well, I guess when I think about the word compassion, it is about alleviating suffering. So the thing that I would invite anybody to do is to look inside and think, how can I alleviate my suffering? I don't have to suffer. And if you're looking at it from that Christian perspective, it is about how do we help others not suffer? Well, also, how can we help ourselves not suffer? And if you're looking for therapy, have a conversation with the therapist and say, look, this is what really matters to me. Will you hold that in good faith and kindness in our work? And that should help indicate for you whether that sort of therapy feels right for you or not.
Wow, wow, wow. That is really good advice. And I also like to add on that, I noticed, Anya, in several parts of our conversation, you kept giving a caveat. You kept saying, this is one way of doing it, and there are many ways of approaching it. But this is your philosophy. This is how you were trained in. And I think it's very important to find a therapist who has that sort of humility as well. Because I have experienced and also seen, unfortunately, therapists who say like this is the one way and the only way that it can be done. And sometimes they might be trained in like from like spiritually they call it like a inner healing or deliverance. And I have nothing against those methods, but when somebody comes and says that this is the only way and this is the best way and there is no other way and you have to listen to me, you have to do what I tell you to, I think those are really red flags because I think in a therapeutic relationship, there needs to be a sense of trust and honor that's built and not a sense of intimidation and fear. Would you agree with that, Anya?
100%. And I will always say when people, particularly when people have been recommended me, I will say, have you spoken to anybody else? I can't be all things to all people. And this is how I work. I'm more relational. As we've established today, I'm quite chatty. I like to talk a lot. I like to really develop a relationship. Now, that isn't right for all people. Some people want really structured therapy. They want homework. They want really measurable outcomes. So something like CBT would be much more appropriate for them. I think
Mm,
it's the research shows it's the relationship that matters and actually feeling that connection. So
wow.
that's why I say to people, go and talk to other people and then listen inside. Did it feel, how did it feel when I spoke to Anya? How did it feel when I spoke to Simon or Hannah or whoever? I'm thinking about my list of people I offer around. How did it feel when I spoke to those people? And actually, what I need to do is listen to my internal system, and I need to respond with what they say because that's what's really important. And I will be right for some people and I won't be right for others. And that's really okay. And I've even said to people, look, if I'm not right for you, but you're really struggling, come back to me and I can talk to you a little bit more about the other models so that you can have a better idea of what
Wow.
you are looking for.
Wow. Anya, I think this is the perfect place to end because I think you've given us such profound wisdom and advice. I'm just reflecting on my own journey. And I remember in my head, there was a very big dissonance between how my body was feeling. I was in a lot of physical pain from after
Mm.
the operation. And in my head, I kept telling myself, if I get healing from these certain people, these certain spiritual people in authority, I will get better. And I did not realize that at the time, I was underneath people of authority in spiritual places of power that were causing the harm to me. And what you're saying is so important because you're saying, listen to your body. What is your body telling you? And I think so often we tell ourselves, it's mind over matter. It's mind over matter. This is what we're supposed to do. But you've given us a real nugget of wisdom, which is as you talk to different people. I mean, I have had spiritual leaders who also invested and sowed wonderful things in my life. But every time you have an interaction with someone, one thing I want to leave with our listeners is, how does it make you feel inside? And listen to your body, because trauma is stored in the body, and how you feel inside can also be such an important marker of how the Holy Spirit is working in you. So instead of differentiating and segregating faith versus science, I really want to invite each and every one of you today to kind of allow yourselves to be in a space where you can see God working in both spheres inside of you, to integrate them both, to know that the body that you have been given is actually made by God. And so the feelings and the senses, that dissonance, that congruence that you feel, these are all prompts from the Holy Spirit as to, is this person giving me the help that I really need? Is this person alleviating or deepening my suffering? And I hope that that can be a guiding light to you in a way to help you discover your own path of healing forward. So Anya, thank you so much for being with us today. I am so grateful that you came on today.
Well, thank you so much for having me. It's been a real pleasure to be here today. Thank you.
Thank you for being here and for having the courage to listen. If something stirred in you today, I hope you'll be kind and tender to yourself. If this episode resonated, I'd love for you to share it with someone who might need it too. And if you are walking through something heavy, please don't walk alone. Reach out to a trusted friend or a professional. If some of these conversations have encouraged you and you'd like to help us continue creating thoughtful, hope-filled content through Dream Brave, write to us at hello@kitedreams.org to find out how to support this work. I'm Wai-Jia, and this is Tender and Wild on Dream Brave. Until next time, be tender with yourself and stay brave always.